The food we eat is processed into three major parts: carbohydrates, fat, and protein. These parts are used as a source of energy, and what is not required is stored inside the body, mostly as fat. The ratio of what is used to what is stored is a complicated process, the basic factor being the input, diet, to output, exercise. Most fat is deposited deep inside the body and can only be reduced by proper diet and exercise. To a lesser extent, fat is deposited under the skin. This fat is 2 parts deep and superficial. This fat can be reduced by using a process called liposuction. The areas to be treated may vary from one individual to another. Before undergoing liposuction, your surgeon will ask you to try other means of shaping your body and will discuss your areas of concern, which may be resistant to those means. The areas that can be treated with liposuction are legs, including ankles, calves, knees, inner thighs and outer thighs; waist and abdomen, breast, chest and overdeveloped male breasts, buttocks and hips, the back of upper arms, and the neck and chin. Liposuction is a surgical procedure that should be carried out in an operating theatre type environment. Depending on the techniques used and the amount of fat to be removed, it is either done with full general anesthesia or sedative drugs and local anesthesia. The apparatus used for the surgery includes cannulas to infiltrate large amounts of fluid and anesthesia into the fat, cannulas to aspirate the fat connected to a suction machine. After the areas of concern are marked with a pen and anesthesia is introduced, multiple small cuts are made. A cannula is introduced to infiltrate large quantities of fluid. Then another cannula connected to a suction machine is introduced to aspirate the fat cells. The surgeon moves the cannula back and forth through the fat layers to remove the fat and create a series of tunnels at different depths and in different directions. With modern surgical techniques and instruments, experienced surgeons are able to aspirate and shape the thin superficial layers of fat. This gives a more aesthetically satisfying result and is known as liposculpture. After surgery, the treated areas are compressed with elastic garments, causing the tunnels to collapse and reducing the thickness of the fat layer. The garment must be worn continuously for 2 weeks and periodically for another 6 weeks. Though swelling and bruising are likely to occur, they generally disappear within a week of surgery. Most people can return to work within 3 to 14 days, depending on the extent of the treatment. With modern surgical techniques, up to 5 liters of fat can be removed with relative safety. However, this does not represent much in terms of weight loss. Liposuction is a shaping technique and is not a weight loss procedure. This common misconception can often give patients unrealistic expectations. As with any surgery, there are some risks involved with the liposuction procedure. Risks can include unevenness or asymmetric results, including rippling or dimpling. If not settled after 3 months, further surgery may be required. Blood and fluid collected under the skin. This will usually resolve itself, though it can be drained surgically. Brown spots or discoloration, which may occur in the treated areas. Damage to the skin, temporary loss of sensation or numbness, and general surgical problems which may occur, such as infection, bleeding, deep vein thrombosis, clots to the heart or lungs, and anesthetic problems. Liposuction is a widely practiced procedure in cosmetic surgery, both on its own and combined with other procedures. If principal surgical guidelines are followed, the risk involved is minimal.